Now, if you've been following the case numbers over the last several days, you know that there's been a big reason for why we've been having all these high level of case rates all across Jackson County. News Watch 12's Haley Gravitt joins us live in studio. Haley, I know you've been tracking and trying to get a better understanding of why we've been having these higher level of cases. Why has this been all going on?
Yeah, Brett. Well, according to Dr. O'Keefe with the Jackson County Public Health, case numbers do not tell the whole story when it comes to COVID-19 in Jackson County. In the last 2 weeks, we saw hospitalization records really increase here within the county. It's a trend Jackson County Public Health was anticipating.
Hospitalization numbers really increased a lot in the last 2 weeks.
But Dr. O'Keefe said that not all trends are reflective of what the county is experiencing.
So those case rates are not reflective entirely of what's going on, although I think in general they show us a trend. So the trend is numbers have been high, without a doubt. COVID is present, Omicron is present, and it's in a lot of places.
And while the hospitals are focusing on giving the care to the patients that need it, hospital staff is also getting COVID.
I think one of the biggest ways it's been impacting the county so far is people out sick. They can't work, and that impacts every industry. So we are seeing that across the board, including in the medical world.
The state is sending outside teams of nurses and other medical personnel to help lend a hand.
And so we are working very hard. There's lots of groups working on getting patients out of the hospital who don't need to be there anymore so that they can be in a safe place and get the level of care that they need. And simultaneously, those beds can be opened up for people who need the acute hospital level care.
Now, another big concern in hospitals is that patients are waiting to be admitted to secondary care facilities because there isn't enough staff or hospital space to transfer these patients. Now, tonight at 8, I'll tell you that there may be some hope on the horizon. Live in studio, Haley Gravitt, News Watch 12.